A lot of people are under the misimpression that PRI is just about, here's a bunch of tests. If you fail these tests, meaning you're failing these range of motion tests, just give a bunch of exercises and you'll be fine. And in reality, that's not how it goes. They really do not understand the subtleties and the thinking and the thought process that goes behind what techniques you're trying to use with somebody and why you're using them. So a lot of people, again, they just think, oh, give me a hamstring exercise, an adductor exercise, an ab exercise, because they're thinking of it in conventional, gym training type of terms, or exercise, general exercise. But that's really not what postural restoration is about. And I'm going to I'm going to explain a thought process that I used yesterday with a client who came to see me. The gentleman I saw yesterday, I've known for well over a year. I've probably seen him about 5 times. The first time he ever saw me, we could get nothing done. He could not pass the adduction drop test. He could not internally rotate his shoulders. He could not horizontally and he could not side bend his neck. He was completely locked up in this PEC pattern. So with the first session, again, we couldn't really get much done with him. And then we got him a new pair of shoes, I put him in my sneakers, and he did have a little bit of improvement, but not much. Pretty soon we realized he was so neck driven, his neck was so tight, that he was going to need a mandibular splint, just like this one, like I have for myself. The next time I saw him, when he came with his splint, it was a completely different story. He was passing almost all of his tests. His neck had completely relaxed. His body was in a way more relaxed state. And at that point, we could start doing some PRI techniques that, as you may know if you've done any PRI, you have to get neutral first and then learn how to start using the left side of your body, start to stabilize the left hip, start to breathe diaphragmatically as much as possible, and then start to use the right side of your body also. So once we got his pelvis out of this PEC, bilateral PEC position where both sides of the pelvis were forward and now they're back, then we had to get his pelvis to shift to the left, learn how to use his left hamstring, his left adductor, his left glute medius, his left internal obliques, and then eventually get his right glute into the game. And you can't do all that at once, especially for someone who's been locked up in the neck for so long. They're not typical. They're not just a left AIC pattern. Most people who come to see me for pain are not just typical left AIC patterns. So they all have built-in instability or built-in tension that's been accumulating for a very, very long time. And you don't necessarily know where that built-in tension is going to appear most. So when this gentleman came to see me yesterday, his biggest issue I deduced was a breathing issue. First, he had stopped wearing his splint because we found that his testing was actually better without the splint. And the last time I saw him was in, I think, early fall. And then he came to see me again. And unfortunately, he was right back into this pattern. His testing was very different than it was originally. It's not as bad as it was, but he was still definitely back in the pattern. So what I did notice was his hip flexors were tight on both sides, even though he could adduct both of his legs. He was overusing his hip flexors, but he couldn't internally rotate his shoulders, which means in the front of the neck area, he was tight through here because he had almost full horizontal abduction. So my guess was it was the front of his neck and his neck in general that was preventing the internal rotation of the shoulders. So we got his splint. He put the splint back in, which he had not worn in a very long time, and most of his testing cleared up immediately. But he still had a very, very tight right hamstring, so tight that when I tried to do a straight leg raise, the knee would start to bend at about 70 degrees. And then coupled with the tight or overactive left hip flexors and the inability to expand his right upper chest with air. So when I would hold his ribs down on the left side to test to see whether he could get air into the upper right chest to expand that area with air, which commonly gets tight or closed off when our neck is tight in this right side. He could get air into the left side, which is normal. He could not get air into his right side. So those tests and my history with him is what drove my decisions on the 2 techniques that I'm about to show you that we did. So what I wanted to do was get his right quadricep to work with his left hamstring. So we want a right quad, my right quad, and a left hamstring to work together while he was breathing diaphragmatically with the left side. And that's what this technique is teaching him to do. Every time he would take a breath in, now this is me, obviously, not him, but every time he took a breath in, his right knee straightened. As he exhaled, the right knee came back down. The entire time, he's engaging his left hamstring by pushing his left leg down into the table. And he's feeling his back push into the table as he takes a breath in, as he's also sensing the table push into him. We're just using a physics explanation to get him to sense what needs to happen. He needs to be able to expand his posterior rib cage on the left side with the left hamstring, while the right quad, which would be right here, is extending the knee and then allowing it to flex, but that helps bring the pelvis on the right side forward. So so he gets oriented to the left side. So after that, I retested him. His right leg was completely relaxed and his hip flexors were off, and he was then able to, he was still a little bit limited here, but it was a little bit better. So then I realized I had him stand up. He was doing a standing technique, but I saw he kept arching his back as he tried to shift into his left side, into his left hip during a standing technique. And so at that point, I wanted to teach him to extend his spine in the correct way. So when you're extended, you're not extending, well, you kind of are, but you are extending from an extended position. That's not real extension. That's just extending from an extended position. To truly extend, you need to learn how to get into a state of flexion first and then extend. And that would have some meaning to your brain. But the difference is you're going to learn how to flex first, which he already knew how to do. So this is not something you would do in the first session with somebody who is like him. None of these techniques are probably first session techniques or something you would do with a stranger, because they probably couldn't do it. Their body probably couldn't handle all the coordinated activities. These are things that I chose specifically for this individual, because that's how PRI is supposed to work. You're choosing techniques specific for this individual based upon what you see their limitations as. So he's going to relearn how to extend his spine, but not in a state of extension. He's going to be in a state of neutrality, because he's going to have abdominal and hamstring control as this extension of the spine occurs, but it's really being driven by air, and it's being driven by breathing. So he's relearning how to extend his spine, but not like this. Is he going back a little bit? Yes, but because he has abdominal control and hamstring control, he's not extending his body. And then what he's also doing is he's having his arms alternate. Because someone who has a neck that's tight, the anterior neck is tight, they're going to be held in a bit of a forward head posture. At that point, the arms are not going to swing appropriately, because you have them, well, for a variety of reasons. The neck is going to be controlling the shoulder complex, but you also have this muscle that goes from the hyoid bone, it's called the omohyoid, goes from the hyoid bone, right, which is right here, all the way to the scapulas. So your shoulder blades, proper shoulder movement and arm swing and overhead pressing, all that is really dependent on having a relaxed neck. If the neck is forward and this omohyoid muscle and the other neck muscles tighten up and are being used inappropriately, you're not going to be able to use your shoulder blades properly, your scapulas properly. So this technique that you're seeing here, he's in this state of flexion. Air has extended his spine. Inhalation has extended his spine in a good way, he's not extending without appropriate support. He's extending with appropriate support from hamstrings and abdominals. And then he's learning how to use his arms to move up and down. He's relearning how to use his arms without his neck getting in the way, because he still has his abdominals holding on to this rib cage so they don't fly up. Once they fly up, you're going to have to overuse your neck to bring those arms up. So he's relearning how to swing his arms while staying stable through his pelvis and his rib cage, so that his neck does not have to try to swing the arms for him. And what he noticed, and why this is a sensory technique and it's not a exercise, I asked him to feel, as his arms went up or down, I wanted him to feel, did anything change underneath his feet? And he said, let me try. And as he did it, and as the right arm came down, he said, right there, I feel more ground underneath my right foot. And that was the trick. For me, that's what I wanted him to sense. People who are tight in their neck, they're not grounded. If they were grounded, they wouldn't be tight in their neck. So his arm coming down and the left arm going up grounded him through the foot that the arm was coming down on. And then as that arm went up, would unground him from that side and ground him on the other side. So he was walking without even moving. His brain was sensing alternating pressure underneath his feet being driven by the arms. That's why arm swing is so important. It's the arms that place our feet on the next step. And so that's what I did. All of this was so that his back would relax and his neck would learn to stay off, which means his brain is finally sensing alternating pressure from the ground, stability through the pelvis, a rib cage that can expand with air. All this area is now neutral, and now he can relearn to use his arms without restriction coming from anywhere else, particularly the neck. And that's really how PRI is supposed to work. It may be completely new to you if you don't know anything about PRI. If you've done PRI online, if you've done PRI in person, that's really the thought process. We're trying to figure out where this individual's limitation is and then use techniques to take away this limitation. It's not easy. It is not easy at all. And it takes many, many years, even as a practitioner, and I'm taking 30 seminars, and I've been doing this for 10 years, and I have my own experience. It is not easy to do to figure all this out. And the idea that people are going to figure this out on their own, they get upset that they can't figure it out online or through watching YouTube videos or Instagram videos, and they can't figure out what to do. How would you possibly figure that out, what I just explained? It's really not going to happen because that's not your profession. I wouldn't be able to figure out your profession, most likely. It would probably take me a couple of years, or depending on what you're doing. But if your profession isn't, if you're not just like me, who's professionally dedicated to this is my thing, and obviously dancing, because dancing and PRI are not much different. But if that's not your profession, how would you expect to figure all this out? This is the brain. And not only that, this is not universal. This came from the mind of an individual in Lincoln, Nebraska, who saw things completely different. This is not being taught anywhere. The way of looking at this from a very non-mechanical point of view, this is not taught. So don't think that this is some normal information that everyone has. It is not. There's a very small amount of people who are actually doing this type of work. And it takes a lot of dedication. And so again, if you're looking for help, you want to find someone who's on the PRI website, because there's a big difference between someone who's PRI influenced and PRI credentialed. Very big difference. Someone who's PRI credentialed is all in. Someone who's PRI influenced, they may not be seeing the big picture the way that I'm seeing it, or people who are credentialed are seeing it.